3 brown spots on your face, what they are, why they're there, and how we fix them. First off, we're talking about age spots or sunspots. These are spots that occur because of dysregulation of the formation of pigment. They can be treated with topical medications or high-level lasers that basically blast them and burn them off. Chemical peels are good too. Number 2, melasma. This is a big no-no. Be careful with melasma. Young, healthy patients, it's hormonally triggered and it's made worse by heat. You need to be very careful if you do a laser or BBL. It will only come back worse. Topical medications are better, peels are the best, and there are other hormones and oral medications that you can take that can make it better, including tranexamic acid. So be very careful with melasma. Young girls have that brown stuff that goes on here and here. The last brown spot is the most difficult and most careful to treat. That's something called PIH, okay? That is basically post-inflammatory hyperpigmentation. All browns come from being red or from being inflamed at some point, but if you've had a laser treatment, if you've had an injection, if you've had a bruise, and then the area turns brown afterwards, that's that post-inflammatory hyperpigmentation. That needs to be treated first with a topical medication to block the formation of new pigment, and then with additional procedures like lasers or other medications or other peels that can help lighten it up. All 3 of these are very tricky brown spots. They're different. One occurs in old people, one occurs in middle-aged women, and the other can occur in anybody who's had a treatment before. Be careful with these different types of brown spots. You can make them worse and not better, so make sure that you go to the right person for the right result.